The new school year is quickly approaching, and families are being reminded to update immunization requirements for students. Let's welcome Dr. Catherine Richardson, Medical Director for the Lowcountry region of the South Carolina Department of Public Health, with more on what's changing, what's not changing. So today, how many vaccinations are required for students to attend public education?
Well, it depends on what grade they're in, but generally for daycare as well as schools, there's the Tdap, polio, MMR, varicella, Hib, pneumococcal vaccine, and Hepatitis A, and I may be forgetting a few others.
And these are all vaccinations that are required a few years into life, so not necessarily the ones that babies get as soon as they're born, but these are vaccinations that are actually required maybe within a couple of years or the year of attending school?
Well, many of them are required beginning in infancy for those who are in daycare, but there are others that may not start until later in life, and so that's why it's really done by grade.
Okay, so no new vaccinations are required this year.
Correct, no new required vaccinations.
But there's a slightly different schedule to everything.
That's right. There are 3 changes. Varicella, 2 doses of varicella, or that prevents chickenpox, are now required for everyone in grades 11 and under. That moved up a year from last year, and that's how we introduce new vaccine requirements as it continues to move from one year to the next until we get through 12th grade. The next one that is different is the Tdap, which is for tetanus and pertussis, as well as diphtheria, and it has now moved to those ages 10 and up do need a booster at that age rather than age 7.
I see.
And then the last one is Hepatitis A, and that is now for 5th graders, and those below need 2 doses. The first given after 1 year, and the second dose at least 6 months after the first.
So all of these vaccinations that you've mentioned, these are imperative. So if your child wants to attend public school, they have to have these vaccinations. Are there any exceptions to the rule?
There are. So there's a certificate of immunization that is required for all children in daycare as well as schools, public and private. There are 2 exceptions. There's a medical exemption. Your healthcare provider can provide that. Often it's temporary for a medical condition, and there's an expiration date, and that does need to be signed by your healthcare provider. The second is a religious exemption. Then the parent is saying 1 or more of these vaccines is, according to my religious views, contraindicated. That certificate you can get from the Department of Public Health, and the parent must sign it in front of a notary.
You know, when we were experiencing the pandemic and we were hearing a lot about herd immunity.
Yes.
So how important is it for the bulk of students to have these vaccinations in order to prevent potentially contracting one of these diseases?
Yes, it's vitally important, not only for their own health, but there are a small percentage of children that cannot get vaccinated. That's the medical exemption avenue, and it protects not only the child who gets the vaccines, but also those in the community that may be at risk. For pertussis, for instance, the whooping cough, children under the age of 2 months cannot receive that vaccine, but they're actually most in danger for hospitalizations and deaths for pertussis. So others getting that vaccine is vitally important to protecting our youngest and most vulnerable community members.
So is our population still vulnerable to contracting these diseases? When we think about chickenpox, I mean, they used to have chickenpox parties, but it's still very prevalent within the system, the ecosystem, if you will.
Well, it really depends on the infection, how contagious or infectious it is.
Measles is
a great example. That's right. We've seen more measles cases this year than the past 3 decades. And because it is so contagious, we need about 95% of the population to be immune to measles for herd immunity for that infection. And unfortunately, we here in South Carolina, kindergartners that have 2 doses of the MMR, or measles, mumps, rubella vaccine, has fallen below that 95%. So we certainly are at risk for an outbreak if measles were to come and be introduced into our communities.
And just with a couple of seconds left, so I learned something before we got started, is that you don't have these general assemblies anymore where everybody stands in line and gets their vaccination. There are other ways in which parents can have their children vaccinated.
There are,
yeah.
And so the best way is through your pediatrician or healthcare provider. They can take care of all your healthcare needs in addition to vaccines. But we at the South Carolina Department of Public Health also have immunization clinics. We're having some back-to-school immunization clinics set up, particularly in evening hours for those who may need other options. There are many other organizations that provide vaccines as well.
I want to thank you so much, Dr. Richardson, for joining us.
Thanks for having me.
Great information. We'll be back after this.